Hi, I'm James Sutton. This is Road to Recovery. Today, my special guest is Monica White, who's come all the way here from Baltimore. And welcome, Monica.
Thank you. Thanks for having me.
Can you tell us a little bit about yourself?
So my name is Monica White, formerly known as Monica Scott. Most people in this industry know me as Monica Scott and not White. So I've recently been married.
Congratulations.
Thank you. So my name is now officially Monica White, and so trying to brand myself as Monica White now.
Okay, I'm going to remember that.
Okay. So I am currently the executive director of Misha House, which is an outpatient treatment facility in Baltimore City that provides outpatient treatment as well as supportive housing. We incorporate peers in every aspect of the service delivery that we offer.
Wow, good.
And I also hold a position on the Maryland Addiction Behavioral Health Professional Certification Board here in Maryland. And I am the chair of the peer committee. And we oversee everything related to peers in the state of Maryland as it relates to certification, training and education, supervising of peers, clinical or peer professionals. We also hold other credentials for clinicians as it relates to the criminal justice system, co-occurring disorders, and addiction.
Wow, fantastic. Now, the board is not that old, but I'm glad that it exists. I'm glad that the other board agreed to the board for peers, right?
Yeah. So the Maryland Behavioral Health Addiction Board has been in existence for quite some time, over 30 years. However, we've just adapted peer services for individuals in Maryland. So it became an official credential in 2014.
Okay.
And the process of developing the peer certification came about in 2014, and the actual peer credential went into effect in 2016.
Right. Now, I'm a registered peer supervisor.
Okay.
So when did that come in effect?
The registered peer supervisors were always in effect. However, it was you just needed to take a specific training.
Right.
But a couple of years ago, I think 2017 actually, we formulated the peer certification for supervisors.
Right.
To make it official, because peers needed to have a supervisor.
Right.
And not only did they need to have a supervisor, they needed to have individuals who were trained to supervise peers. Most individuals are trained to supervise clinicians.
True. That's true.
And so a clinician would supervise a peer specialist differently from a clinician. So
Right.
A clinical supervisor needed to be trained on how to effectively support and supervise a peer specialist.
Right. I'm glad you made that distinction, because in Montgomery County initially it was licensed clinicians that were supervising the peers as we became recovery coaches, and then started expanding the Ross movement here in Montgomery County. Now, how have the peers been accepted? Are they accepted in the treatment centers in Baltimore? Are there more opportunities opening up for peer specialists?
Yes, I'm glad you asked that. There are several employment opportunities. When we first started, there were a lot of volunteer positions for peers, volunteer services, because most individuals weren't aware of what peers could actually do within their agencies. And so the board has done a lot of work to be able to educate organizations that are interested in bringing peers in their facilities. However, we have several organizations across the state that there are grant dollars associated with bringing peers in.
Oh, I didn't know that.
There are, a lot of grassroots opportunities. There are some agencies that still apply, that still qualify for grant money through the state and federal. And so those agencies are not trained and educated about bringing peers in their agencies. They just know that their grant money that's associated with providing services says that you need certified peers in your agency. And so they begin to recruit individuals into their agency, but they do not have the understanding of what peers do, how they're supposed to operate and function within their agency. So we get a lot of miscommunication from the peers,
Right.
stating that they're asking me to do things that are beyond my scope of practice.
Wow, and that's a great point. I'm glad you brought that up because I'm CCAR, trained as a trainer of trainer,
Okay.
and I've had everything that CCAR offers, so that I'm able to do ethics and professionalism and
Okay.
a lot of different dimensions of being a peer and a recovery coach. And I know the agencies over here in Montgomery County, they wanted to get on board, and some of them were mandated to get on board and start adding a peer position, to the vendors' bids, right?
Absolutely.
But they didn't know what to do once they had them. They didn't have any job description.
Right.
And so, like you said, they could be misused, which is
Absolutely.
unethical.
Absolutely.
Right? And also, it's not good for the peer.
Not at all.
Because if they get burned out doing stuff that's not even in their lane,
Right.
they could relapse.
And then those agencies can reach out to the board, and someone like myself or some other members of the peer committee can come out to the agency and be able to have a discussion with the upper management about how to utilize peers in your agency, what their job functions are, and how they are a better support to their clinical staff. One of the great pushbacks that we get is that the peers are there to take the clinician's position. That's not what they're there for.
Right.
They're there to be able to remove some of those menial tasks that the clinician is bogged down with that's of a non-clinical practice.
Okay.
So, for instance, referring them to a recovery program, getting them connected to community supports. That's something that the peer can do as opposed to the clinician. The utilizing the peers in this capacity frees up the clinician to be able to conduct an individual session, to do the necessary therapy and counseling that's necessary to be able to gain the necessary coping skills and the different theoretical practices that are used to be able to support an individual through the treatment phase of their recovery process. Then the peer steps in to be able to bridge the gap between treatment and community.
Okay.
And that's where they're best and most effective, to support them in getting linked to outside agencies beyond the walls of the treatment facility.
Right. I was never afraid. I mean, I'm an addiction counselor, that's my career, but I wasn't afraid. I wasn't scared I was going to lose my job, right? So I welcome the help, right?
Absolutely, absolutely.
And especially because it just makes so much sense that a person who has lived the experiences, that speaks the same language as your population, trust is easier.
Right.
They're going to trust a person that they can relate to more so than a person who may have the information to help them, but that stigma of, they haven't walked in my shoes, so I can't talk to them, right? So I know here, one of our most effective programs has been the STEER program in the ER.
Okay.
I mean, our team the numbers have gone up, dramatically of how many people we've gotten into treatment, how many people we've gotten into housing after treatment, all leading from an overdose.
Absolutely.
Right? So,
absolutely.
And I know I got a good friend, she's working at Hopkins in Baltimore, and she's doing a great job as a peer.
Okay.
Yeah,
there are several peer programs in the city of Baltimore, as well as surrounding counties. So there is, Baltimore County has what's called the Rapid Response Team.
Okay.
So there, you call their reach line for any type of support, and peers answer the phone. It's like a hotline, but instead of having a clinician answer the phone, the peer actually answers the phone and gets them connected to support. They may go out into the community to engage them, to get them connected to services. We have services both in Baltimore City and Baltimore County where the peer in the LEAD program, where peers are connected with the Baltimore City and Baltimore County police departments, and instead of, as a diversionary method, instead of sending them to jail or arresting them because of a drug-related offense, they may connect them with a peer to be able to get them engaged in treatment, detoxification, or medication management, or even to a community housing program in the community. So
Right. That's excellent because, you know, we want to look at addiction as a health concern more so than a criminal justice
right,
concern.
absolutely.
So that's sounds like a great program,
It
and I'm
is,
sure it's
it
working
is.
out.
And several other counties are buying into this idea because it takes more to incarcerate an individual than it does to treat the individual for their underlying issue. Because yes, you may catch them in the store. They may be arrested for petty theft or breaking and entering in someone's house, but the underlying issue is the fact that they currently have a drug addiction.
Right.
And in order to feed their disease, they will do what's necessary to be able to gain monies to be able to
Sure.
support their addiction.
Sure. So it's a win-win situation for the community
Absolutely.
because it's cost effective.
Yes.
And that's usually what
The main thing.
That's the main thing. You know, is it going to
Yeah.
save us money, right?
Right.
And it does save us money. Treatment saves much more money than incarceration.
Absolutely.
Right. And using peers saves the agency more money because,
Yes.
like you said, the clinicians are freed up to do what they were trained to do
Absolutely.
instead of some of the more menial, as you phrase, jobs like welcoming.
Yes.
I know in Philly, a lot of the peers are the first people. That's the first line of defense. When you walk in a treatment center, you're greeted. When you're in a bad mood, you're sick, you're ill, you don't even want to be there. It's a welcoming person who has been there, done that, right?
Right.
Who encourages you not to leave treatment, to stay, just stay another day. Can I get you something to eat?
Yes.
You know, I know how you feel. You know, I got you.
Yeah.
You know, don't go nowhere.
Right. Right.
So that's, in Philly, they were saying that not only has it helped increase the numbers of people who stayed, but didn't leave treatments once they were in treatment because they were peers incorporated in the programs in PROAC in Philly, right?
Absolutely. So that's how Misha House is structured. So at every level of service delivery that we have peers that work consistently with the individuals. Every house manager or resident aide that we have in our housing units have gone through CCAR training to be able to give them the fundamental skills to be able to support those individuals. I'm currently in the process of trying to write a curriculum specifically for recovery resident staff. Because the service delivery at that level is different from the service delivery at the treatment center level, as well as it's different from the community outreach level. So being able to give them the necessary skills within an internal environment where they're more in close proximity with the individuals on a regular basis, will be able to give them a little extra skill set along with what they already get from CCAR, what they already get from RAP facilitator or RAP training or mental health first aid. You know, they're able to be able to get the necessary information and education in a different environment. And so with that being rolled out, more peers will be able to gain the necessary skills to support people in housing.
So enroll me now. All right.
Okay.
When will it be ready?
It probably won't be ready till the start of the next year in 2020.
Okay, well, I definitely want to be on the front line of that one, right?
Okay,
you can sign me
great.
up now.
Yes, yes.
So we're coming to a break for a minute, but I want to come back and ask you more about housing because I know Carlos Haney told me a lot of things are happening with the Turk House and stuff like that. So I know housing is, matter of fact, the data shows that when people come home from incarceration, employment and housing are some of the biggest things that the lack of cause them to recidivize or relapse.
Absolutely.
So we're going to take a break right now. My guest, Monica White, is here today, and this is Road to Recovery.
I'm always the first one up. I'm always up for a challenge. I'll overcome any obstacle. I don't believe in limits. I refuse to be average.
Hi, I'm James Sutton, back with Road to Recovery. My special guest, Monica White. So Monica, you were talking about the housing, recovery housing in Baltimore. Now, why is it important to have certified peers in sober houses?
So for one thing, the individuals are trained and educated to be able to be a support to individuals in that capacity, as well as utilizing how to utilize their personal experiences to be able to help to individuals to bridge their own gaps and overcome their own hurdles. Because as we know in the clinical world, you said it earlier, that if you haven't walked in my shoes, then you don't understand where I've come from. And so the way that my program has designed, Misha House is designed to hire from within. So we hire no one from external when it relates to the housing component, for the simple fact that if you've been a person that has been through the housing, has learned the rules and regulations, you understand how you try to finagle the rules and regulations a little bit. You're a little bit more insightful when you see someone else. And being able to use your skills as a peer specialist to be able to use your motivational interviewing skills, to be able to understand the stages of change and how to navigate that person through whatever stage of change they're currently in, through your own personal lived experiences, is what they do on the housing level. And it's become effective. So.
That sounds great. And you know, because I work in the jail here in Clarksburg, right? I work in the jail addiction services. And my guys are encouraged about becoming recovery coaches because they look at it as a career, right? They look at it as nobody was going to hire me, but this is something that actually all the crazy stuff I've done is actually, I can use that, right?
Yes.
I don't have to be so ashamed.
Not
I can actually build on it, right?
Yes. And then the other thing of that is this population of individuals that we work with tend to have gaps in their resume.
Yeah,
and so being able to give them an opportunity to work for the first time in a long time will be able to help fill in the gaps in their applications or in their resumes, so that when they do look for a job on their own independently away from an organization, they'll have something to put on there to fall back on. And a lot of our peers have used that as a stepping stone to be able to become employed at other agencies. So we have three individuals that have come through our program, became house managers. We sent them to Recovery Coach Academy training. We've helped to support them to be able to obtain some of the other additional trainings towards certification, and now are working in other treatment facilities in the city based on the knowledge, skills, and abilities that they were able to practice and learn at Misha House.
Oh, that's great. And, you know, my last guest, Jimmy Frazier Bay, you know, he has Wells Robinson House, and that's a great model. He talked about a lot of what you're saying. Yeah. You know, a lot of the life skills that, you know, the residents of Wells Robinson, you know, are strong recovery skills, you know, how to balance a checkbook, how to cook food, how to shop.
Life skills,
just
basic life skills.
So when you have a person that's been doing that successfully, and they can show a person who's never done it, never been responsible, never had a job, you know, only had like, you know, jail time, maybe had a laundry job in the jail or whatever. Yeah. They can learn, you know, how to navigate, you know.
Absolutely.
So that's a great learning opportunity that sounds like that you're providing for the citizens of Baltimore.
Absolutely. And we take individuals all across the state, and then some people come to us.
Oh, is that right?
Yes, some people come to us from other states as well. We have a young lady recently engaged in our program that came from D.C. We have we have a gentleman and a young lady that came from Philadelphia that uprooted themselves and came to Baltimore because they needed a geographical change and to be able to get a fresh start. So getting them connected to services and supports in the community is what our peers do. We don't do that as clinicians. We turn that over to our peer staff to be able to ensure that they get a bus pass, that they get a Maryland State ID, that they get a birth certificate and Social Security card. Those are things that a peer can handle because they know how to navigate the system. Because even though a clinician may refer them for those services, they don't know what goes on in those certain situations because we're not the ones that are going with the individuals to these appointments. The peers go. And so the peers can be able to support them when one of the social workers at these agencies attempt to re-traumatize an individual based on the fact that I'm already in an impoverished state. I'm already have to humble myself and ask you for help. but also to be able to not be humiliated because I need help at this time. And the peer is there to be able to support them through those emotions that they may be feeling, the level of uncomfortability that comes along with having to start over.
Wow,
So.
you know, you hit the nail on the head. That re-traumatization, right? Because everybody is not really a good consumer, you know, employee.
Right.
You know, you can get a mean person that's talking on the phone when you stood in line for 2 hours. You're trying to get vital documents.
Yes.
You know, for the first time, you're trying to do the right thing, and you can get really angry when people don't pay attention to you, act like you're invisible.
Yes.
And a peer can, you know, help them emotionally and spiritually weather that experience, because it's going to happen, because it happens to us no matter who you are, you know, unfortunately, you know. So I'm glad that your program is providing those kind of services.
Yes.
Now, what else is happening in Baltimore? Are you having any success with the treatment centers? Like Carlos was telling me about Turk House. Do you have a lot of peers in Turk House?
So there are peers in the Turk House. However, what we're finding out is that there is not adequate supervision in some of these facilities.
Okay.
You have individuals who have been trained as, or educated or certified as a registered peer supervisor. However, there may be 20 peers within your agency that are being supervised by this one individual. That's a lot.
Yeah, that's a lot.
You know, because of what the registered peer supervisor is required to provide to the individual. Because again, supervising a peer is totally different from what it is to supervise a clinician. So you have to be a little bit more engaged in the peer's personal life, because of the simple fact their personal life and their personal experiences are what you've hired them to be able to do and to be able to promote that within your agency. So it's always about being a role model. One of the many things that peer is supposed to promote is role model behavior. That's what the knowledge, skills, and abilities associated with mentoring and education domain of being trained as a peer offers, to be able to always promote yourself as a role model to individuals. And so the supervisor also must put on that hat of being a role model to the individual. So if the supervisor is overwhelmed with their caseload and their responsibilities at work, what it does is it promotes the same thing for the individual who is providing peer services to the community. It says the peer will do exactly what the supervisor does. So if the supervisor blows off appointments with the peer or other individuals in the community, the peer specialists will learn to do the same thing to the individuals they're supporting within the community. So you have to be mindful of how many people you have supervising peers on your caseload at work, because it's still anybody supervising 20 individuals in any community is too much.
Yeah, that's a system problem.
Absolutely, absolutely.
Now, and I'm glad you told the truth about it, because that, you know, that's, if it is, that's the way it is, right? And we have to like work on money, because a lot of times that's because programs don't have the money to improve the system, you know, so the system hasn't adapted. It's crashing. It will eventually adapt as it crashes, but, you know, with more money, we can do better jobs at designing systems that are more effective at serving people and giving them good quality of service. Now, at your at Misha House, how do the residents pay? Is it Medicaid, or do they pay rent, or what?
As it relates to treatment, individuals through the treatment program, the Medicaid pays for treatment.
Okay.
It pays for the outpatient services. However, it does not provide housing. It does not pay for housing. And so we've partnered with other agencies. We got some grant dollars. We've been able to become a Maryland Recovery Net provider.
Oh, yeah, Recovery Net. Good.
So we do find ways and means to get individuals housing funds to be able to support them for anywhere from 2 months to 2 to 4 months. And so Misha House has a partnership with the Baltimore County Health Department, as well as the Department of Parole and Probation, as well as having being a MDRN provider, a housing provider. So we get individuals funding through one of those 3 streams if they're eligible. And if they're not, then we try to work with the individual until they're able to get a job. We support them. And then the peer also has the ability to connect them with other resources outside in the community that they've been able to touch on and be able to support them. So we try to work with them as best we can to be able to help to offset the cost
Right.
of their housing.
Yeah, because that's a big problem for me when I have inmates leaving the jail. They don't have any money for housing, and Recovery Net is one of the few options in the state of Maryland that will carry a person for a few months.
And the other thing that Misha House has been able to do, like I said before, we've partnered with the Department of Parole and Probation, so we've become eligible for grant money through the state to provide housing to individuals who are on parole or probation once entering into the community. So that has been able to unburden individuals re-entering into society with where am I going to live and how am I going to support myself. So we've been able to do that for those individuals, and those grant dollars cover an individual for housing for anywhere from 120 days or until their parole and probation ends, whichever comes first. But it cannot exceed 120 days. So if they are paroled for 2 months prior to their sentence being terminated, then they'll be funded for 2 months until their probation or parole has ended.
You're going to have to hook me up because I need some of that money. So we're coming toward the end of the program. It went too fast, right? I have to have you back.
Okay.
So are there any closing remarks, things that you definitely want the audience to hear from you or understand about peers in the workforce, or the work that you're doing?
So I just want to be able to move this this workforce forward, to be able to strengthen them, to be able to support them, to be able to encourage them that the peers, there's not a ceiling for them. You can go anywhere you want to go beyond where you are. Don't allow any workforce, any supervisor, any agency to tell you that, well, this is as far as you can go. You can go as far as you want in this career if you choose to, depending on what avenue you choose to take beyond just being a peer. Because you hear people saying, I'm just a peer. No, you are a peer. It is a viable work and a viable employment position, and be proud of who you've become, because some people have had to go to school to do what you do, but you've taken your life experiences and used that to your advantage to be able to support and help someone to move out of a condition of dependence and into a condition of independence.
Right. That's great. That's a great closing for us, because we definitely want to use peers, because that's been a missing link in our workforce.
Absolutely.
And it's such a vital resource that has been just laying dormant.
Right.
I'm glad that people like you are starting to encourage people and actually build systems to make it work effectively and professionally.
Yes.
So today, my guest has been Monica White, talking about peers and how they are effective in the workforce, and how we can use peers in shelters and recovery houses, ERs. And she says all the hospitals in Baltimore are using peers. So we're going to just look forward to more opportunities like drug courts and other treatment centers to get on the bandwagon.
Absolutely.
And hire peers.
Absolutely.
So thank you again.
You're welcome.
This is
Thanks for
James
having
Sutton.
me.
It's been Road to Recovery, and I'll see you on the road to recovery.